my name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the back and
you said I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Sean. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Shiraldin,
and I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
just you try to say something.
treatment the same day. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and today we are live with Santosh, and today we are before treatment live, and in the future we are going to post treatment live also. Santosh is having a voice problem. It's a high pitch voice, feminine voice, and he was having puberphonia during his puberty, and that has been not be corrected properly, so his high pitch or childish voice still going on, and his age is 33 years. और नमस्कार दोस्तों, मेरा नाम संजय कुमार है, बाय प्रोफेशन स्पीच लैंग्वेज पैथोलॉजिस्ट एंड ऑडियोलॉजिस्ट हूँ, और आप सभी का स्वागत है हमारे यूट्यूब चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पे. आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं संतोष कुमार जी के साथ, और संतोष जी को प्यूबर्टी के दौरान एक प्रॉब्लम थी जिसको बोलते हैं पुबरफोनिया, जिसका प्रॉपर ट्रीटमेंट नहीं हुआ, और उसके वजह से अभी इनकी एज 33 ईयर्स है, और आज भी वो पतली आवाज़ और हाई पिच वॉइस में बोल रहे हैं. और हम लोग भविष्य में ट्रीटमेंट के बाद भी लाइव होंगे, तो आप लोग हमारा यूट्यूब चैनल को सब्सक्राइब कर लीजिए और भविष्य में इनका ट्रीटमेंट के बाद का लाइव ज़रूर देखिए. तो संतोष, जस्ट टेल अबाउट योर प्रॉब्लम एंड व्हाई यू कॉन्टेक्टेड अस, व्हाट प्रॉब्लम यू आर फेसिंग.
Hello sir, my name is Santosh. I am from Hyderabad and my age is 33. So I have a problem like high pitched voice, like feminized voice since like 15 years. So I went to many ENT hospitals, contacted hospitals, and still they didn't resolve my problem. Like still I am facing the same problem. And even I went to like one of the super specialty hospitals, but they literally scared me like, okay, by doing this speech therapy, you won't get the male voice because we have to go for a surgery. So I scared about it and I just skipped that one. So I thought, okay, it will be like lifelong the same problem I have to face. But when I saw your videos in the YouTube, then I got enough confidence that okay, even I can change my voice. So that's the reason I just approached you, sir.
Okay, so I can say little awareness is lagging. People think that if the patient age is very high, it can't be corrected into the low pitch. But I want to just inform, we have corrected at our center 55 years age person also. If you'll explore my YouTube channel, you will find also. And in fact, the duration of treatment was almost same what I treated 18 years old guy. So little awareness is needed.
Yes, sir.
And of course, first we should try voice therapy. If it doesn't work, then you should think about the surgery. And even after surgery also, you have to take voice therapy. Then why not first you should try to take voice therapy. So in today's live, there are a few points I have written, and I'm going to discuss about those points. And this is for awareness purpose. I will talk about puberphonia, sign and symptoms, the cause of puberphonia, diagnosis and treatment. I will also talk about we should take voice therapy or surgery, or when you should take to go for surgery and when you should go for the voice therapy. And even I will be talking about side effects of wrong vocal exercise or vocal abuse. And even I will be discussing about what is the difference between the real speech therapist and fake speech therapist. Because of the social media, there are so many fake speech therapists also. So I will talk about those points. So before starting the one by one points, basic information I will try to give how the speech production mechanism is. Then we will be able to correlate why the problem is. So let's understand how the normal speech production mechanism. For normal speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put a air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds will generate. Then we modify that sound with the help of our articulators like lips, tongue, jaw, teeth, palate to different sound. For example, if you want to say p, both the lips are coming closer together and touching each other. When you want to say t, tongue is coming between the teeth. When you want to say k, back of the tongue is getting elevated and touching the soft palate. So each and every sound has its own place, own manner of articulation. If place of articulation will be wrong, manner of articulation will be wrong, there will be pronunciation problem. We call misarticulation, mispronunciation. Of course, you are not having, just for awareness I'm talking. So when you think about the normal speech production mechanism, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sound generate, we modify that sound into different sound, one after the another. Because in one sentence, there are so many words. In each word, there are so many sound. Each sound has its own place, own manner of articulation. So it is little complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, fluency goes. That will be seen in case of a stammering. Of course, you are not having a stammering, just for information I'm saying. So in the stammering, what will happen? There will be something lagging the coordination among the speech production muscles with the brain. Now, let's come to your problem, because you had puberphonia during your puberty and it was not treated. So why the puberphonia occurs? So we will explaining the reason why the puberphonia. So during puberty, mass and the length of the vocal cord changes due to a hormone called testosterone. If mass and the length of the vocal cord will increase, the pitch reduces. I will repeat again. During puberty, mass and the length of the vocal cord changes in case of voice due to the hormone called testosterone. Because of the testosterone, mass of the vocal cord will increase, length will increase, then pitch reduces. You can correlate with this phenomena with guitar string also. Like this, in the guitar string, thin string produces high pitch voice, thick string produces low pitch voice. So before puberty, the vocal cords will be like a thin string of a guitar. So the pitch will be higher, like it will be more shrill, more childish or feminine, we can say. But during puberty, because of the hormone testosterone, mass of the vocal cord will increase, length of the vocal cord will increase, so pitch will reduce. So in the guitar also, you must have seen that thick string produces low pitch voice. So after puberty, the vocal cord will behave like a thick string of a guitar, so pitch will be lower. That happens in most of the people. But in case like your puberty, during puberty, mass got changed, length got changed, but because of your so many years habit, you have not accepted the change which has happened during the puberty. So your vocal cord mass is normal like us, okay, like me. But because of your so many years habit, to maintain your childish voice during puberty, you just try to utilize to vibrate the thin edges of the vocal cord even after puberty to maintain your childish voice. Why? Because of so many years you spoke in a high pitch voice. So the vocal cord mass length is sufficient, but to maintain the childish voice, you are vibrating only thin edges of the vocal cord. So when you are vibrating the thin edges of the vocal cord is a thick string but behaving like a thin string. So when guitar string will be the thin, the pitch will be higher. So that is the cause of the purophonia. Main cause. There may be some other reason also, but this is the main cause. Okay. And other question was purophonia sign and symptoms. So of course, after listening to your voice, people will get an idea. If child has crossed his puberty and still his voice is like a feminine childish voice, so we can say that it may be the symptom of purophonia, but other things also should be ruled out after consulting to a healthcare professional, those who are expert in this area, like some other issues, like sometime the muscle tension dysphonia, sometime phonatory gap, and sometime sulcus vocalis. So proper evaluation is important. So being a speech pathologist, and most of the time, based on the perceptual evaluation, I'll be able to understand this is the purophonia or it's not. But sometime I may not be getting clear picture. So in that case, I suggest laryngoscopy or stroboscopy. So it depends upon how expert the speech pathologist is. If he's very confident this is the purophonia, it's okay. He can start the treatment if he's very, very confident. But if he has any small doubt, then he should go for the stroboscopy or laryngoscopy to rule out any other pathology like a sulcus vocalis, muscle tension dysphonia, and any other problems. So what I discussed, that was the main problem that are, and even I have seen that untreated purophonia, if because your vocal cord is ready to produce the low pitch voice and you are using high pitch voice. So it's a kind of vocal abuse, and vocal abuse sometimes result into the vocal nodule. So there are certain studies which says that untreated purophonia can result into the vocal nodule, but not all the cases. Like every smokers will not get the cancer same way. All untreated purophonia will not result into the nodule, but in some cases it may be. So if you know that you are a male and your puberty you have crossed the puberty and your pitch is still higher, you should take the help of the speech language pathologist to correct it. And so cause we discussed, and the purophonia sign and symptoms also we discussed, like voice will be like a child even after puberty, or it will be like a feminine or high pitch. So this can be the sign and symptoms. And treatment, let's talk about the treatment. So in the treatment, what we will do as a voice therapist, we will try to stimulate the whole mass and the whole length of the vocal cord to vibrate effectively. In case of purophonia, only thin edges of the vocal cords will be vibrating. But what we'll do as a voice therapist will try to stimulate whole mass and the whole length of the vocal cord to vibrate in effective manner. So once whole mass and whole length will be stimulated, so vibrating mass will increase, vibrating length will increase. The vocal cord, which was behaving like earlier a thin string of a guitar, it will start behaving like a thick string of a guitar. Then pitch will reduce. So this will be the main thing. And sometime in extreme case, I think the voice therapy doesn't work. In that case, you should think about the surgery. But even after surgery, you should take after the voice therapy only. Even after surgery, you have to take the voice therapy. Then only the outcome will be visible. So that's why the people say, and most of the people are agree on this point. First, you should try voice therapy. And let's talk about the duration of treatment also. This will be also a very common question. So in our clinic, we have seen offline treatment. Most of the time we will be correcting in 8 days, but there are exceptional situations also. In online, we are seeing in some patient 8 days improvement, and sometimes it is taking more time also, sometimes 2 weeks also. But of course, we have seen good result in 8 days also. So this is the duration of treatment, and health science is not 2 + 2 = 4. So one patient has improved in 14 days. It doesn't mean that all the patient will improve in 14 days, in 18 days also, or more than 14 days also. And sometime in exceptional situations, voice therapy doesn't work. So based on my experience, once the patient called to me, I do the perceptual evaluation and I get an idea how the voice therapy is going to help him or not. And if sometime I'll not be able to understand the communication problem or voice problem, I suggest the patient to go for the laryngoscopy, stroboscopy, but not all the cases required for the stroboscopy and laryngoscopy having communication disorder. And next, I have written one question based on my YouTube comments. Yeah, side effect of wrong vocal exercise or vocal abuse. Yeah. So whenever you are taking voice therapy, you should always take the help of speech pathologist, expert in treating voice disorder. If you try to do the self-treatment, you don't know what exercise has to be done for what communication problem. And even after reading some textbook in speech pathology, you will get an idea, okay, this exercise to be used. Then that exercise, how to be used, that you will not able to understand by the textbook. Like you will not be able to understand the reading a textbook of swimming and inside sitting in a room. So same way, this kind of voice therapy technique, once you work with the patient, and many patient will get better idea. Of course, book will support, but this book will give how to do the exercise, what exercise has to do. But when you come to the how to do, the practical exposure is very, very important. Reading a book, we can't become a surgeon. After reading a book, you can't become a surgeon. Best book also usually, but you have to do the surgery to develop the skill. So after reading the book, you should work with the patient, and not one patient, many patients. Then you will get a confidence how to do such kind of. This is a science plus art both. Like treating voice disorder is not only the science plus art, I will say. So that's why the different speech pathologist treatment result will be different. So science you can find out in textbook, but art, it's a kind of learning and learning and learning. With experience it comes. And then I was talking how to differentiate between real speech therapist and the fake speech therapist, because nowadays I can see in the social media, I can see many website, so many fake speech therapists are available. And people sometimes go to those places and think that they are going to a real speech therapist. So whenever you are going to take speech therapy services, voice therapy services, first try to find out the therapist with whom you are going to take your services, what is his name, in which hospital, which clinic he works, from where he has studied. He has graduation degree in the speech language pathology or speech hearing sciences, or post-graduation degree. What is the name of the college, from which university the college is affiliated. He is registered in the Rehabilitation Council of India or not. If he has registered, what is the registration number? If you have a doubt, put that registration number in the Rehabilitation Council of India's website and cross-check with that registration number, that name exists or not. And if such fake speech therapists are spoiling your voice, speech, or communication problem, they are spoiling your health, even you can report to the RCI. RCI will take the legal action. So these are the things for the awareness purpose. And now I'll be coming to the questions of those who are watching this live. But before that, I will tell Santosh, tell about yourself and why you contacted me. Let's people listen your voice once more.
Hello, sir. Myself Santosh. I am from Hyderabad, and my age is 33. I have have done my MBA. Right now, I'm doing in MNC. I'm going to say I'm working in MNC in Hyderabad. I have a problem like high pitch voice, feminized voice from last 15 years, and I consulted many ENT doctors, but no one proved okay, your problem will be resolved. But even I went to some super specialty hospital also, but they suggest me for surgery. So I just came back home and just okay, it's okay. Nothing is no problem is with this voice, right? So that's the reason. So I just skipped everything. So after so many years, I just saw your videos. Like I didn't type about these videos, but I just want to know what is the problem for this type of voice. So I got like Puberphonia in YouTube. So I searched like that. So I saw your videos. Not even like 10, 20. Like I saw like 50s or 60s videos of yours in YouTube.
Yeah, in
Then I
our
got a
YouTube channel,
confidence that okay, even my problem will be solved if I contacted you. So I thought, okay, I just want to go, I just want to come to Bangalore and just want to take the treatment, but due to the COVID, so it's not happened. So I thought, okay, you just close that speech therapy office, so I thought, okay, recently I contacted one of your colleagues, so she told me that, okay, now we are doing like live session, I mean to say Skype treatment. So I thought, okay, it will work out for me. So that's the reason I just contacted you, sir.
Okay, thank you. And I'll add few points. So even I started my YouTube channel in the year 2010 to create awareness about the communication problem. Of course, you have seen little less, and those who are watching this live, they can find thousands of video before and after treatment of different communication disorder. And I'm trying to create awareness, and I'm trying to motivate the people in patient as well as the professionals also to create awareness about the communication problem and its outcome by the voice therapy. And if you'll explore our YouTube channel, those who are first time watching our live session or they have not gone to our YouTube channel, people can find different communication disorder like, of course, Puberphonia pre and post treatment video playlist you will find at our YouTube channel. You will find sulcus vocalis pre and post treatment videos. You will find the stammering pre post treatment videos. You will find vocal cord paralysis and dysphonia pre-post treatment videos. You will find misarticulation pre-post treatment video. You will find aphasia which happen after a stroke pre-post treatment videos. You will also find spasmodic dysphonia pre and post treatment videos, functional aphonia pre and post treatment videos. So my suggestion is that at least once you try to explore our YouTube channel's playlist, so you'll come to know that what are the communication disorder and how the speech pathologist or speech language therapy can help to the people's communication problem in case of communication problem. So this is just for awareness. And many question I get, like how to contact you, sir. So like how to contact. It's so simple. You can go to our website. Website name is www.speechtherapyindia.in. Click the reach me. You will find our contact number. You'll find our email ID. You will find on the Google map where is the clinic situated. So you can contact us by any of the method. And because of the COVID, I'm working from home. So clinic is closed. So landline number will not be working, but you can mail us and we'll contact you. And you can leave in the email your contact details, phone number. So we'll call you. And I just wanted to inform those who are watching this live, I want to say everyone, I'm able to read and see your comments. So I want to tell all the names, like Brijesh has joined. Thanks Brijesh for joining us. Mahesh DN saying hi, good evening, sir. Hi, Mahesh, good evening. And Atul Rajput is saying, Tutlana kaise theek kare? Thanks, Atul. We'll discuss very soon. And even Musarraf SK has joined. Thanks, Musarraf, for joining us. And Mahesh Kushwaha is saying, good evening, sir. Good evening, Mahesh Kushwaha. So let's come to the question answer. And Atul Rajput is asking, Tutlana kaise theek kare? So Tutlana means misarticulation, pronunciation problem. So first let's understand why the pronunciation problem occurs, then I will come to the how to correct it. As I told during the speech production, first thing is the thoughts, then we take air, that air goes to the lungs. When we breathe out, put the air pressure below the vocal cords move, sound generate, then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. For example, if you want to say p, lips are coming closer together and touching each other. When you want to say t, tongue is coming between the teeth. When you want to say k, back of the tongue is getting elevated. So in a very simple way, each and every sound has its own place, own manner of articulation. So if place will be wrong or manner will be wrong, or both place and manner will be wrong. So there will be pronunciation problem. For example, if you want to say t, tongue should come between the teeth. So instead of putting tongue inside in between the teeth, you are putting tongue somewhere on the palate or somewhere else. So instead of the, some other sounds will be coming. So whenever the pronunciation problem is there, either its place is wrong or manner is wrong or both are wrong. So उन्होंने हिंदी में पूछा था, तो मैं हिंदी में ही आंसर देना चाहूँगा कि हर एक साउंड का अपना एक प्रॉपर जगह होता है और एक प्रॉपर तरीका होता है. अगर जगह गलत होगा, तरीका गलत होगा, तो प्रोनाउंसिएशन की समस्या होगी. जैसे कि त बोलना है, तो त के प्रोडक्शन के समय में टंग को दांतों के बीच में आना चाहिए. तो टंग को दांतों के बीच में न लगा के आप कहीं और लगाएंगे तो प्रोनाउंसिएशन की समस्या दिखेगी. तो इसके लिए हम लोग क्या करते हैं, कई बार प्रोनाउंसिएशन की जो समस्या होती है वो हियरिंग से भी रिलेटेड हो सकती है. तो हम लोग रूल आउट करते हैं कि हियरिंग की तो समस्या कुछ नहीं है. ज़रूरत पड़ता है तो हियरिंग टेस्ट भी करते हैं, और अगर ऐसी कुछ लॉस होती है तो सुनाई की मशीन भी लगाते हैं मिस आर्टिकुलेशन प्रोनाउंसिएशन के केस में. और ज़्यादातर केसेस में सुनाई की समस्या नहीं होती है. तो हम लोग सिर्फ प्लेस ऑफ आर्टिकुलेशन, मैनर ऑफ आर्टिकुलेशन सिखा करके जिसको हम लोग टेक्निकली बोलते हैं आर्टिकुलेशन थेरेपी, जो कि स्पीच थेरेपी का ही एक पार्ट होता है। इससे वॉइस थेरेपी क्या हुआ, वो भी स्पीच थेरेपी का ही एक पार्ट है, जो कि वॉइस पे हम लोग काम करते हैं। उसी तरह से आर्टिकुलेशन पे जब हम काम करते हैं तो उसको बोलते हैं आर्टिकुलेशन थेरेपी, जो कि एक स्पीच थेरेपी का ही एक पार्ट होता है। तो उसके माध्यम से हम लोग करेक्ट कर सकते हैं। तो मैं उनको सजेस्ट करूँगा कि आप किसी भी स्पीच थेरेपिस्ट से मिलिए अतुल जी, और ये काफ़ी ईजिली करेक्ट हो जाता है मोस्ट केसेस में। ठीक है, और नेक्स्ट क्वेश्चन इज देयर मोसारा इसके सर, मेरा हाई स्पीच वॉइस का प्रॉब्लम है, मैंने कांटेक्ट किया था बट मुझे बोला था कि आप कॉल करेंगे बट कॉल नहीं किया, तो हो सकता है गलती से छूट गया हो। तो आप जो है हमें मेल कीजिए अपना कॉन्टैक्ट नंबर के साथ और हम लोग दोबारा से आपको कॉल कर लेंगे। मुसारा जी, अभी हमारा क्लिनिक क्लोज है तो इसलिए हम लोग वर्क फ्रॉम होम कर रहे हैं, तो कभी कभी मिस हो जाता है। ठीक है, और हमारा ईमेल आईडी मुसारा इसके लिखते हैं कि सर ईमेल आईडी सेंड कीजिए। तो हमारा कॉन्टैक्ट डिटेल हमारे वेबसाइट पे अवेलेबल है। हमारा वेबसाइट है www.speechtherapyindia.in, और उस पर क्लिक कीजिए रीच मी, फिर उसके बाद हमारा ईमेल आईडी, कॉन्टैक्ट नंबर सब कुछ मिल जाएगा। ठीक है, और एक पूछ रहे हैं बेथ चंगेज, इज पियोफोनिया एंड डिस्फोनिया डिफरेंट? Dysphonia is a broad term. Any problem in the voice we call it dysphonia. Dysphonia means something wrong in the voice. That wrong can be hoarse voice, that the wrong can be breathy voice, that wrong thing can be 18-year-old boy is talking in a female voice. That is also, we can say, dysphonia. So dysphonia is a very broad term, and that includes all kind of voice problem. So and puberphonia is very specific, like the problem which happened during the puberty, and the boy age is pubertal age and he's having voice problem, so we can say puberphonia. If the patient age is 30 years, he is not at pubertal age, so I'll not be saying puberphonia. But during puberphonia there is some voice problem, and especially even after puberty, the child is talking in a childish voice even after puberty or during puberty, and the voice is breaking, voice is coming hoarse, breathy, so it may be puberphonia. So if pubertal age is not there, then technically, scientifically, it's not correct. Sometimes people may use wrongly also, or maybe that habit is there because puberphonia was during puberty and still persisting, so people may use sometime puberphonia, but technically puberphonia word should be used during the puberty. And sometimes those who are not speech pathologists, they don't know the technical thing, and they see something and they make some videos, and also for everything they will write puberphonia sometime. Like if only the high pitch voice, feminine voice is there, they will think everything is puberphonia, because high pitch voice even can occur like in case of sulcus vocalis, the nature has not given the sufficient mass and the length of the vocal cord, so that time also can high pitch voice. There can be testosterone hormonal issue, that time also can be high pitch voice. There can be muscle tension dysphonia, phonatory gap, that time also high pitch voice. But those who are jola chap and all, sometime they will make the videos of every high pitch voice like puberphonia. And even those who are not speech pathologists and try to work in the area of speech pathology with incomplete knowledge, so even 35 years age patient also, they will use puberphonia technically. But my opinion is puberphonia word should be used during puberty. Puberphonia, puber means puberty, phonia means something related to the voice. The voice problem which happened during the puberty is puberphonia. And Brijesh is like writing, sir, treatment technique, something he's asking. So if we'll tell about the treatment technique, there will be many jhola chhap doctor will come out, many fake speech therapists. They will learn something and they will try, and many patient will try self-treatment. So that may damage voice and the vocal cords. So that I never suggest, and that I don't explain in the live session. For that, first we listen that what patient is having the problem, and depending upon that, we suggest individual therapy we give. Otherwise, what will happen? Wrong vocal exercise, wrong way of doing a vocal exercise may damage the vocal cords. So during live on the social media, I don't show the technique exactly, because it may damage sometime. And any vocal exercise should be done under the supervision of speech language pathologist, expert in voice disorder, then it works better. And yeah, so any question will be there. Then I'll be continuing. I think we don't have much questions, so any more question will be there, I'll be answering, otherwise we'll stop this live. So if you have question, I'm able to see everyone, so please you can ask the question, otherwise we may stop. But by the time Santosh, you know Hindi?
Yes, sir. I know Hindi.
ओके, तो थोड़ा सा हिंदी में भी बता दीजिए क्या प्रॉब्लम थी, ताकि लोगों को पता चल पाए। आज हम लोग ट्रीटमेंट से लाइव हो रहे हैं, बता दीजिए पहले ट्रीटमेंट।
हाय एवरीवन, मेरा नाम है संतोष, मैं हैदराबाद से हूँ, मेरा एज है 33 इयर्स। मुझे हाई पिच वॉइस का प्रॉब्लम है, बोले तो लड़की का वॉइस जैसा मेरा वॉइस है। तो कभी भी मैं किसी से बात करे तो सब लोग मुझे किसी तरह से देखते रहते थे, क्या है इसका, इनका वॉइस क्या है, ऐसा है वो कैसा। तो एवरी टाइम मुझे तो थोड़ा तकलीफ तो होता था वो टाइम पे। तो मैं ENT स्पेशलिस्ट से भी कांटेक्ट किया था वो टाइम पे, मगर वो लोग सेल्फ एक्सरसाइज मुझे सजेस्ट किए थे वो लोग, बट वो 2-3 दिन किया था, मगर मुझे वर्कआउट नहीं हुआ था। सो मैं क्या किया, फिर एक सुपर स्पेशलिटी हॉस्पिटल गया था। तो वो लोग सजेस्ट किया था कि नहीं, अभी तुम्हें स्पीच थेरेपी से कुछ नहीं होगा, क्योंकि इट्स ऑलरेडी यू क्रॉस लाइक 28 और 29। तो अभी तो तुम्हें एक ही ऑप्शन है, वो भी सर्जरी है बोल के बोले थे। मगर सर्जरी भी 100% एश्योरेंस नहीं दिया था, कि वो बोले थे कि 90% होगा, मगर 10 और 5% आपको वॉइस का भी कुछ प्रॉब्लम आएगा, मगर 90% तो होगा बोल के बोले। देन मुझे तो थोड़ा डर लगा था कि सर्जरी बोले तो मैं सोचा कि ठीक है, सर्जरी तो नहीं कर सकता हूँ अभी तो, क्योंकि मुझे थोड़ा डर तो आ गया था कि अभी तो वॉइस है, मगर अगर सर्जरी के बाद कुछ वो लोग ऑपरेशन कुछ फेल हुआ तो ये वॉइस भी नहीं रहेगा बोल के डर था मुझे। तो इसीलिए मैं ठीक है, मैं छोड़ दिया ऐसे। स्टिल मैं ये प्रॉब्लम तो फेस करते रहता था बहुत सालों से, मगर संजय सर का वीडियोस देखा था रिसेंटली, लाइक 1.5 ईयर बैक। तो वो टाइम से मैं एक्चुअली सर से कांटेक्ट करने के लिए चाह रहा था, मगर मुझे मेरे ऑफिस में लीव भी नहीं दे रहे थे 8 डेज बोले तो मैं अभी तो कोविड के टाइम है ना, तो सर अभी क्लिनिक भी ऑफ है बोल के बोले, तो सर लोग अभी ऑनलाइन ट्रीटमेंट दे रहे बोल के सुना था। तो इमीडिएटली मुझे लास्ट वीक ही मालूम चला कि सर ऑनलाइन में ट्रीटमेंट दे रहे बोल के। तो लास्ट वीक ही मैं कांटेक्ट किया, तो इमीडिएटली सर को बोला कि आई एम रेडी टू फॉर द ट्रीटमेंट बोल के। सो यही मेरा प्रॉब्लम अभी तक। तो होपिंग सो विल गेट ए बेटर रिजल्ट फॉर मी। थैंक यू सर।
एक चीज़ मैं यहाँ पे ऐड करना चाहूँगा, जो कि आपके साथ भी ये चैलेंज हुआ कि जैसे आपकी एज है 33 इयर्स, तो आपको सर्जरी के लिए सजेस्ट किया गया, शायद वो एज को देख करके उन लोगों ने सोचा कि प्यूबरफोनिया को प्यूबर्टी में ही सिर्फ वॉइस थेरेपी से ठीक किया जा सकता है, और प्यूबर्टी खत्म हो गई तो शायद सर्जरी ही सॉल्यूशन है। तो मेरा ये मानना है कि नहीं, इवन 33 इयर्स में और इवन उससे भी ज़्यादा हमारे क्लिनिक में अभी तक के हाईएस्ट एज जो ग्रुप हैं, हाई पिच वॉइस वाले जो पेशेंट या ऐसे पेशेंट जिनको प्यूबर्टी के दौरान प्यूबरफोनिया रही थी और उन्होंने ट्रीटमेंट नहीं लिया और उसी तरह की पतली आवाज़ को कंटिन्यू किया अप टू एज ऑफ 55 इयर्स, और फिर 55 इयर्स एज में पता चला कि ऐसे वॉइस थेरेपी होती है और हमारे क्लिनिक में है, उनको भी फ़ायदा हुआ। तो अगर आप हमारे यूट्यूब चैनल को एक्सप्लोर करेंगे तो 55 इयर्स के हाईएस्ट एज के पेशेंट मिल जाएंगे। तो अगर कोई कहते हैं कि एज 33 इयर्स हो गया है और वॉइस थेरेपी से कुछ नहीं होगा, चलो सर्जरी करा लीजिए, तो मैं इस बात से मेरा पर्सनल जो ऑब्जर्वेशन है और पर्सनल एक्सपीरियंस के आधार पर कहूँगा कि मैं सहमत पूरी तरह से नहीं हूँ। पहले एक बार वॉइस थेरेपी ट्राई करना चाहिए, और वॉइस थेरेपी सपोज आप गए कहीं पे कराने के लिए किसी स्पीच पैथोलॉजिस्ट या स्पीच थेरेपिस्ट के पास, काम नहीं किया, तो इमीडिएटली इस कंक्लूजन पे नहीं पहुंच जाइए कि अच्छा मैं तो वॉइस थेरेपी का कैंडिडेट नहीं हूँ, चलो सर्जरी करा लेता हूँ, क्योंकि ये प्रॉब्लम बहुत ही रेयर प्रॉब्लम है। तो हो सकता है आप जिस स्पीच पैथोलॉजिस्ट या स्पीच थेरेपिस्ट वॉइस थेरेपिस्ट के पास गए हों, उनकी एक्सपर्टीज किसी दूसरे कम्युनिकेशन डिसऑर्डर में रही हो, तो हो सकता है फ़ायदा नहीं हुआ। तो आपको एक ऐसे वॉइस थेरेपिस्ट या स्पीच थेरेपिस्ट स्पीच पैथोलॉजिस्ट को ढूंढना चाहिए जिनकी एक्सपर्टीज पर्टिकुलरली वॉइस डिसऑर्डर एरिया में हो, और उनसे भी जब फ़ायदा नहीं पहुंचता है तब आपको फिर सर्जरी के बारे में सोचना चाहिए। और एज से बिल्कुल मत डरिए, अगर 55 इयर्स एज भी है तो भी, और मैं तो कहूँगा उससे भी ज़्यादा है तो भी वॉइस थेरेपी पे आपका बॉडी रिस्पॉन्ड अगर करता है तो चेंज होगा, और मैंने देखा है मैक्सिमम लोगों का करता है। मैं इंटरेस्टिंग चीज़ बता रहा हूँ कि जिस समय मैंने 55 ईयर्स एज वाले पेशेंट का ट्रीटमेंट किया था, तो मैंने ग्रुप थेरेपी उस समय ये किया था। बैंगलोर में ग्रुप थेरेपी में स्टार्ट करता हूँ। तो उस टाइम में मैंने देखा कि एक 55 ईयर्स वाले पेशेंट हैं और एक पेशेंट 18 ईयर्स वाला था। इनफैक्ट मैंने 55 ईयर्स वाला को देखा कि वो ज़्यादा फास्ट इंप्रूव हुआ 18 ईयर्स वाले। मतलब कोई यूनिवर्सल नहीं है। इससे क्या कंक्लूजन निकला कि ये डिपेंड करता है कि आपका बॉडी किस तरह से रिस्पॉन्ड करता है। ठीक है, वो अलग अलग लोगों में रिस्पॉन्ड अलग अलग करता है उस हिसाब से उस समय। लेकिन मैं ये नहीं कर रहा हूँ कि सारे 18 ईयर्स से बेहतर 55 ईयर्स वाले रिस्पॉन्ड करेंगे, ऐसा कोई रूल नहीं है। सारे पर्सन डिफरेंट होते हैं। जैसे कि अगर जो भी स्मोकर्स होते हैं जो लोग, तो सारे स्मोकर्स को तो कैंसर नहीं हो जाता ना, किसी को होता है किसी को नहीं होता है। तो उसी तरह से ऐसा कोई रूल नहीं है कि 55 ईयर्स के हैं तो ज़्यादा बॉडी अच्छा रिस्पॉन्ड करेगा, 18 ईयर्स के हैं तो कम करेगा, ऐसा कोई रूल नहीं है। मतलब अलग अलग लोगों का बॉडी अलग अलग रिस्पॉन्ड करता है। और मेरे लिए तो इंटरेस्टिंग था कि 55 ईयर्स वाले वो फास्ट इंप्रूव किया 18 ईयर्स वाले की अपेक्षा। ठीक है, और दोनों का ऑलमोस्ट 8 डेज में ठीक हो गया था। लेकिन एक्सपीरियंस मेरा ये रहा। तो एज से बिल्कुल मत डरिए, मेरा यही कहना है। अगर ज़्यादा एज भी है, अगर मोटिवेशन है, थेरेपिस्ट पे भरोसा है और ये आपको पेशेंस है कि थेरेपिस्ट जो है आपको जो कहेंगे उसको आप फॉलो करेंगे पूरे जो ईमानदारी के साथ, तो वॉइस थेरेपी आपके लिए अच्छा ऑप्शन है। अगर आपके मन में डर है, डाउट है, तो पहले डर और डाउट को ख़त्म होने दीजिए, फिर हमारे जैसे लोगों से कांटेक्ट करेंगे तो ज़्यादा फायदा होगा। डर और डाउट के साथ आएंगे तो पहली बात, मेरे इंस्ट्रक्शन को आप फॉलो नहीं करेंगे ईमानदारी के साथ। जब फॉलो नहीं करेंगे तो मेरे लिए रिजल्ट भी लाना मुश्किल हो जाता है कई बार। तो मैं चाहता हूँ कि जो भी लोग इस लाइव को देख रहे हैं और प्लान कर रहे हैं हमारे क्लिनिक में, तो कन्फ्यूजन है तो उस कन्फ्यूजन को पहले दूर कीजिए और तब फिर ज्वाइन करेंगे तो ज़्यादा मजा आएगा हम दोनों को। तो ठीक है संतोष, हम लोग स्टॉप करेंगे इस लाइव को।
ओके सर।
और मैं एक बार क्वेश्चन देख लेता हूँ, अगर कुछ क्वेश्चन होगा तो उसका आंसर करूँगा, नहीं तो इस लाइव को स्टॉप करेंगे। हाँ, कुछ नया क्वेश्चन नहीं है मुझे लगता है। हाँ, एक पूछ रहे हैं सर आपकी पर फी कितनी है? तो डिपेंड करता है क्या कम्युनिकेशन डिसऑर्डर है। तो पहले हम जानना चाहेंगे कि आपकी प्रॉब्लम क्या है। तो उसका जो होता है प्रॉपर असेसमेंट, वो असेसमेंट का जो हमारा तरीका होता है परसेप्चुअल इवैल्यूएशन। तो जब हम एक बार परसेप्चुअल इवैल्यूएशन कर लेते हैं, पहला स्टेज होता है हमारा असेसमेंट का, तो कई बार उससे आइडिया मिल जाता है कि क्या कम्युनिकेशन प्रॉब्लम है, उसके हिसाब से हम लोग कमेंट कर पाते हैं ट्रीटमेंट कॉस्ट, ड्यूरेशन, इसके आधार पर। फिर कई बार परसेप्चुअल इवैल्यूएशन से पता नहीं चल पाता है, तो फिर हम लोग एकॉस्टिक एनालिसिस भी करते हैं और उसके बाद ये लैरिंगोस्कोपी या स्ट्रोबोस्कोपी के लिए भी सजेस्ट करते हैं। तो इन सारे इन्फॉर्मेशन जब हमारे पास एकत्रित हो जाते हैं तो फिर हम लोग कमेंट कर पाते हैं कि ट्रीटमेंट ड्यूरेशन और ट्रीटमेंट कॉस्ट क्या होगा। तो मैं चाहूँगा कि जिनके पास भी ये क्वेश्चन है कि ट्रीटमेंट कॉस्ट क्या है, तो हमें कॉल कीजिए पहला स्टेप परसेप्चुअल इवोल्यूशन के लिए। और हो सकता है सिर्फ परसेप्चुअल इवोल्यूशन के आधार पर ही हम कमेंट कर पाएँ ट्रीटमेंट कॉस्ट के बारे में। और कई बार नहीं समझ में आएगा तो फिर हम लोग स्ट्रोबोस्कोपी, लैरिंगोस्कोपी का रिपोर्ट देखने के बाद या फिर एकॉस्टिक एनालिसिस करने के बाद हम जो है कमेंट कर पाएंगे। ये एक क्वेश्चन था मुझे लग रहा है। और ठीक है, और ठीक है, तो अब कुछ नए क्वेश्चंस नहीं आ रहे हैं। जिनको भी कम्युनिकेशन प्रॉब्लम है हमारे वेबसाइट पे जाइए www.speechtherapyindia.in, क्लिक कीजिए रीच मी एंड देन यू विल फाइंड आवर कॉन्टैक्ट डिटेल्स एंड यू कैन रीच अस and you can mail us or you can call us. You can reach physically on the Google Map address is also given. Thank you everyone for joining us and watching us. Thank you so much everyone and thank you Santosh live ke liye.
Thank you sir, thank you.
Thank you so much. We'll stop this live. Thank you so much.
Okay sir, thank you sir.